Good day, everyone. Good day, sir. I am by name Mohammed Abdulrashid Abiodun, and I'll be presenting my term paper with the topic goes thus, measuring the impact of health, education, and knowledge retention to the use of pre and post tests, genotype testing, and compatibility as a case study. This is the presentation of my term paper, the course Social and Behavioral Determinants of Health, MPH821. Genotype um, is a critical public health intervention, and particularly in uh, regions with a high burden of sickle cell disease. So, genotype, as said, is a genotype itself is a genetic makeup that determine the hemoglobin type, either AA, AS, SS. So that's just what genotype itself is. It's a genetic constitution of an individual, specifically the combination of alleles inherited from both parents. So in the situation of sickle cell disease or sickle cell disorder, this is a case whereby someone inherited the S allele from the both parents. Therefore, they become SS. Or let's say someone inherited a pair allele of S from a parent and C allele of C from another parent. So therefore, we have SC, which is another variant of sickle cell disease. So this sickle cell disease is preventable. Yes, it's definitely preventable with an informed decision. It is preventable. Globally, globally, we have more than 300,000 births of sickle cell disease annually. And Nigeria as a country contributes more than 50% of this birth. So that is, Nigeria has more than 150,000 births of sickle cell disorder. So low awareness in terms of health education definitely contributes to high sickle cell disorder prevalence in Nigeria. The objective of this particular study is to improve the understanding of genotype types and compatibility, to correct misconceptions on inheritance patterns. Many people believe that um, the inheritance pattern of sickle cell when a parent of AS, so let's say for example, marry another parent of AFs, we have this unethical and something that does not really have a ground. We have this way of doing the probability whereby we say such person will have 25%, that if the person gave birth to four people, definitely the parents will have two the parents will have two um two children without the what's it called, two children without the sickle cell, one with sickle cell, then one as a carrier. That's 25, 50, 25% ratio. However, that is as well false. As a sickle cell and genotype advocate myself, as a volunteer for an NGO whose which objective is to increase the sickle cell awareness and reduce the number of sickle cell disorder. The warriors, we call them warriors, to reduce the number of warriors in Kwara State here in Ilori. I am fortunate to know that without um being subjective to the probability ratio, a couple with genotype incompatibility can actually give birth to either sickle cell patient or not in any ratio. There is no any standard ratio for who to deduce the ratio of sickle cell children to the normal children. So another objective is to promote accurate testing practices, to also encourage peer education on genotype awareness. So the study design, how this particular project is carried out is we come up with a pre-test and protest design, whereby it's just a one group, 20 people. So all the participants are 20, they are youth between the ages of 17 to 24 in my community, Kankatu Okelele. So what we did is we actually um, we ensure that we give a questionnaire before the workshop that we did. We gave them a 2 hour educational workshop on genotype compatibility and genotype testing. So before the workshop, we give them questionnaire which they answer to know their level of understanding when it comes to genotype compatibility and genotype testing. Then after the workshop as well, we give them that same questionnaire to now answer, just to assess what the impact of that particular workshop education on on health education and knowledge retention. So the tool we use was we use slide presentation, a structured pre-post test through the questionnaire. So the results, um, we during this thing, I told you we had total participant of 20. The result in terms of demographics, we had 13 males and 7 females. So in terms of education level of our participants, tertiary institution, those in tertiary institution, there are 6. The secondary school students are 10. Then we had 4 people with no formal education. The age range, I said earlier, was between 17 and 24 years. Uh, so as well, we ensure that we ask question. We ask question. These are the areas we covered in the questionnaire, in the knowledge area section. The first section here is demographic section. So the other section here is knowledge area section, where we actually ask question that relate to the knowledge regarding genotype compatibility and genotype testing. So the very first question we asked was, have you heard of genotype testing before? So that resonates with this awareness of genotype testing. So the other question we asked, question number 2, what is your genotype? We try to know if all of them actually know what genotype is and understand their genotype. Another one, we actually as well we ask I asked question 3 is which of these genotype pairings, which of the genotype pairings, like when we pair, we are trying to know if they truly understand the pairing of of genotype traits and what could be the result. So we ask which of these genotype pairings is most advisable for marriage. So all these are in the document. So we ask that question and we give them different options for them to choose from. Same way we discuss if another question is if two AS individuals can give birth to a child with AS. Okay, we have to ask that can two AS individuals give birth to a child with SS genotype? So true of us. So we try to know that as well. Also, these reliable testing locations, the question for that cover this one is we try to ask where is the most reliable place to do genotype testing. So we give different options like pharmacy, home, um, hospital, laboratory, so, and which we have our answers. So these are the areas we covered in the other section in the questionnaire. And this is the uh, bar chart showing the what's it called? Showing the results that we got from the question. This blue bar here is showing the 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 pre answer, the pre questionnaire answer, and this um gold or pink or what's it called? Let's say orange color showing the post answer we get from the from our people. So from the question one, from the first question, you can see the rate. It was a bit above 70% correct answer. So here we have only the correct answer shown. This bar chart was done just for the correct answers. So the among the 20 people, we had a bit around for the question one, we had a bit over 70% people that got the first question right. But after the workshop, we had 100% people that got the correct answer. So that's how it shows from the whole what's it called from the whole thing. That's how it's done. We ask them questions saying like, have you heard of genotype testing before? What is a genotype? In the question, have you heard of in the question, what is a genotype? 70% of people, 70% of people actually got it correctly because I as well inserted other options that are not even in any way related to genotype traits. Yet some people are choosing the answer like AA was the first option, then BB, AB. This BB, there's nothing of such in when it comes to genotype traits. There's nothing like AB as well when it comes to genotype. And here we had about 20% people choosing AB and 10% people choosing we had about 20% people choosing BB and 10% people choosing AB. So which is very, very, very wrong. So this is a web chart showing the research. So in conclusion, with the analysis of what we get, uh sorry. Aha. So, the comparative analysis showed a significant improvement in knowledge, across all the questions that we asked. Uh, prior to the intervention, prior to the workshop that we did, misconceptions such as the belief is in invalid genotypes. Some people thinking that there is a genotype trait like BB or AB. So we were able to this shows that we were able to sort that out through our intervention. So Um, what's this? This delete. So, health education improved genotype knowledge as it is shown in our result. Um, the improvement in participants' ability to identify uh, advisable genotype pairings for marriage. So all participants could now identify safe genotype pairings. They were able to understand the genotype pairing for them to know if AS married to an AS person, that would be a bad decision. So they were able to understand that in one of our questions. Uh, Same way, we also strong potential to reduce SED through awareness. We're able to let them know, like in the last, I think the last questions in the questionnaire, will you advise your peers? Will you advise your peers to go for genotype testing before marriage? So we had about 55% people that said yes, but after the workshop, after the intervention, after the health education intervention, all of them, we had 100% people that said they will advise their people to go for genotype testing and genotype compatibility test before marriage. So all participants could now understand better of where tests can be carried out. So we are able with this in the question we asked, where I said we asked them where best can genotype tests can be taken, can be carried out. Some people chose home, some people chose pharmacy, and but in the end, after the workshop, all of them were able to know that it can only be carried out in the laboratory or hospital. So this is the conclusion. So this is a very robust work, and we got to know that um, health we got to know that genotype is a very health is a pose a significant concern to the global health, especially Nigeria, where we are contribute over 50% of the SED deaths we have in the whole world. So we were able to establish the fact that through the post and pre and post test that we did to establish that many people will become a better person in terms of health awareness with the with health education health education. So thank you. This will be the end of the presentation. Thank you. Thank you so much.